Hey, everybody. Welcome back to the Health Matters podcast. I'm Saul Marquez, your host, and today I have the privilege of hosting Caroline Pearson, the Executive Director for Peterson Center on Healthcare and Peterson Health Technology Institute. She enjoys tackling some of the most complex issues in healthcare and brings this passion to the center's mission to create a high-performing health system that lowers spending and improves outcomes. The center runs programs that aim to improve healthcare data, support better market functioning, and transform digital health purchasing. Caroline, thanks so much for joining us.
I'm so glad to be here. Thanks, Saul.
Yeah, so look, before we dive into the work that you guys are up to, tell us a little bit about what inspires your work in healthcare.
I am one of those regular stories. I thought I'd be a doctor growing up. I came from a family of physicians and really became passionate about health policy as I was in college, and then have really gotten into working in the field of policy research and really just trying to translate data into information and inform decision makers.
Thanks for sharing that, Caroline. Yeah, it's great. Your background with your parents in it, it was in your destiny.
It was. I don't know that I could have gotten out. I just put a little bit of a personal twist on it.
I love that. You got to take your own way. Look, let's dive into some of the questions that we have here for you. Why is raising the bar for digital health purchasing so important for the Peterson Center on Healthcare and the Peterson Health Technology Institute? And why now?
The Peterson Center has long been dedicated to improving health outcomes and lowering cost. And unfortunately, we don't have a lot of silver bullets to solve that really audacious problem. And we've always thought that technology should be part of the solution. Technology has the potential to drive better outcomes and produce greater efficiency, but not necessarily the way we're adopting it right now. We went out and we talked to a ton of folks throughout the industry, both digital health developers, purchasers, meaning the health plans, the providers, the employers, and everybody was really overwhelmed. Coming out of the COVID pandemic, there's been tons of investment into the space, a lot of new companies, an opportunity to drive towards more judicious purchasing and make sure that the tools that we're putting into the hands of patients are ones that have great evidence behind them, because I think we all deserve that.
Yeah, and it's a worthwhile mission to be behind because there's so much noise in the market. And how do you identify those right technologies at the right price point to make a difference?
I think one of the things that we did was, after hearing that market need, we decided to launch the Peterson Health Technology Institute. We announced in July. It's an independent, philanthropically backed institution that is really going to evaluate digital health tools and try to identify those that have the best evidence of clinical benefit and the ability to drive budget impact. That's really the mission that we're on, and hope to drive a lot of benefit as a result.
That's great. Yeah, no, thank you. And I think there's a huge need, right? Right now, a lot of people need that type of help. So it's great that you guys are invested and wanting to make a difference. What digital health technologies will PHTI evaluate, and how were those technologies decided?
We just announced this week that we're going to have technologies, remote patient monitoring tools for diabetes management, and second, virtual musculoskeletal solutions, including virtual physical therapy. And we are really looking for interventions that address sort of three big points. First, we want things that have a lot of budget impact. So we're looking for big areas of clinical spending or solutions that have the potential to drive either higher spending or higher savings. So big ticket items. Next, we are really looking for places with great innovation. We have traditional care models. We're looking for technology-based solutions that can really disrupt the system, drive more access, more convenience for patients, and really a lot of innovation in the space. And with that, we need great evidence. We need to look at sectors where there is evidence about how technology can work and how it can deliver value. And then lastly, we listen hard. We've convened a big group of health plans, employers, and providers to say to us, where can we be helpful in driving your decision-making? Ultimately, those are the audiences that are deciding which companies get contracts and which don't. And we want to say, where is there places that we can look closely at the data and give you some information to think about how you're integrating these tools into your delivery model?
Yeah, thanks for sharing that, Caroline. And is there a particular interest for the work that you guys do inside of the four walls of the hospital, in the home, both?
Definitely both. We're starting really focused on clinical technologies. There's a lot of excitement around back-end admin tech, and we will definitely go there in the future. But for now, we're focused on things that are patient-facing, but they can be supports for providers in institutional care delivery models or things that bring that care into the home. A lot of wearables, remote monitoring technology, and things that really enable people to access care in ways that are more convenient to them and don't require them to drive to their doctor's office necessarily.
Got it. Thank you. So you're focused on the continuum of care, but the clinical applications that could make the biggest difference.
Exactly.
Okay.
Exactly.
Very cool. Very cool. Thanks for sharing that. So shifting to a different area, how is PHTI engaging digital health stakeholders and others in its work?
We don't want to be sitting in an ivory tower producing reports that nobody reads. We really want to be market movers. And in order to do that, we need to build really strong relationships with folks across the industry. We are building lots of groups to organize those audiences. We've got that purchaser group that helps us guide our thinking about which technologies we choose and what sorts of report outcomes or outputs will be most valuable to them. We have groups of clinical advisors who help us think about how is that care being delivered today and how will it change with digital technologies. For instance, just because you move care to home, it depends on how that data feeds back to the provider to really link it with the continuum of care and the sort of whole management of that patient. And then really thinking about that patient voice and understanding what's valuable to patients. We believe that digital tools should produce equal or better clinical outcomes for every patient that uses them. And patients deserve to know that when they're using those tools, that they are getting the same benefits that they would if they went to see their doctor. And so really making sure that we're understanding both the benefits to the patients and what they can expect out of that technology on the other end.
It sounds very comprehensive and that you guys are really taking a multi-stakeholder view. So really exciting to really have a partner like you guys in the industry helping get through a lot of the noise.
We are hoping to cut through the noise. Excitement. We think there's great technology out there, and we really want to be a champion for it and make sure that it continues to get adopted and accelerated in the industry.
Yeah. And look, so as we close here, Caroline, what closing thought would you give to our listeners today?
I think it's time for us to evolve how we think about digital health and really drive towards better evidence. We've got amazing claims bubbling around this hall here, and we want to see it backed by evidence because that's the only way that these technology solutions are really going to be here to stay and to drive us towards the next generation of amazing healthcare delivery.
Well said. And folks, in the show notes, you'll find ways to get in touch with Caroline, find out the work that they're up to. But for the sake of somebody listening that might have a pen in hand, Caroline, what's the best way for them to get in touch with you and learn more about the organization?
That's great. First of all, sign up for our mailing list at phti.com and feel free to reach out to us at info@phti.com. We read every email and we'll be happy to get back to you.
Amazing, Caroline. Thank you so much. And folks, take action on what you heard today. You got to have clinical evidence for these technologies to move forward. And thanks to Caroline and the team at PHTI, there's a way forward. Caroline, thanks for being with us.
Thanks so much, Saul.